Script for Dr. Fazal channel. Picture this. It's early morning. You wake up, shuffle to the kitchen, pour yourself a glass of water, and reach for that little pill organizer sitting on the counter. You've done this same routine for years. You take your vitamins, maybe a multivitamin, maybe some vitamin D, maybe a B complex, because you genuinely care about your health. You want strong bones. You want energy. You want to protect your heart. And you figure, if a little is good, a little more can't hurt, right? But here's something that almost no one talks about. Something that doctors are seeing more and more in routine blood work. Something that quietly affects a surprising number of people over the age of 55. People who are doing exactly what you're doing. Taking their vitamins every single morning, thinking they're helping themselves. What if I told you that a common vitamin habit, one that millions of Americans follow every day without a second thought, could actually be silently stressing your liver, not harming it dramatically, not causing obvious pain, just quietly, gradually pushing your liver harder than it should have to work. Today, we're going to talk about exactly what's happening, why it matters specifically as you get older, and, most importantly, what you can do about it. Because this isn't a reason to panic, it's a reason to pay attention. And once you understand what's really going on inside your body when you take certain vitamins, you'll never look at your morning routine the same way again. I'm so glad you're here today. If this is your first time watching, welcome. This is Dr. Fazal's channel, and we're dedicated to giving you the kind of honest, practical health information that actually makes a difference in your everyday life. If you find this helpful, please hit that like button. It helps more people find this information. And if you'd like to stay informed with content like this, go ahead and subscribe. It's completely free, and it means a lot. Now let's get into it. Here's the first thing you need to understand. Not all vitamins are the same. And this is where the mistake begins, because most people think of vitamins as one big category. Vitamins are good for you. Full stop. But there's a crucial distinction that your body cares deeply about, even if you've never thought much about it. There are two types of vitamins, water-soluble and fat-soluble. Water-soluble vitamins, like vitamin C and the B vitamins, dissolve in water. Your body uses what it needs, and then flushes the rest out through your urine. They don't linger. They don't build up. If you take too much, your body handles it pretty efficiently. Fat-soluble vitamins are completely different. Vitamins A, D, E, and K dissolve in fat, not water. And because they dissolve in fat, your body stores them in your fatty tissues and significantly in your liver. Think of it like this. Your liver is like a warehouse. Water-soluble vitamins pass through like delivery trucks that drop off their goods and keep moving. Fat-soluble vitamins are more like boxes that get stacked in the warehouse and stay there. Now, here's where things get really interesting, and where the big mistake most seniors make comes in. Vitamin A is one of the most common fat-soluble vitamins found in everyday supplements. It's in most standard multivitamins. It's in separate supplements. It's even in some calcium and bone support products. And vitamin A is genuinely important. It supports your vision. It helps your immune system. It's involved in cell growth and skin health. But vitamin A is also the fat-soluble vitamin most likely to accumulate to harmful levels, especially as you get older. And the scary part? It can happen quietly, with no dramatic warning signs, over months or even years. Large clinical studies have found that vitamin A toxicity, called hypervitaminosis A, is far more common than most people realize, particularly in adults who supplement regularly. And the organ that takes the hardest hit when vitamin A builds up, your liver. Researchers have observed that excess vitamin A can lead to a condition called hepatotoxicity, liver stress caused by too much of a stored substance. In serious cases, it can contribute to liver fibrosis, which is a kind of scarring that impairs normal liver function. But even before things get to that level, excess stored vitamin A can cause liver inflammation, elevated liver enzymes showing up in blood work, and a general state of liver strain that slowly chips away at your body's ability to detoxify, regulate cholesterol, produce bile, and do the dozens of other things your liver does quietly every single day. And here's what surprises most people when they first hear this. You don't have to be taking mega doses to accumulate too much vitamin A. The problem isn't people popping enormous amounts of vitamin A supplements. The problem is the slow, steady drip of moderate amounts, taken daily, year after year, stacking up in the liver tissue because the body can't flush them out the way it flushes out vitamin C. Think of it like a slow water leak behind a wall. No dramatic burst, no obvious flood, just a gradual buildup of moisture that eventually causes damage you didn't see coming. And after the age of 55, this risk goes up significantly. Here's why. As you get older, your liver naturally becomes less efficient at processing and clearing stored substances. It doesn't work as hard or as fast as it did when you were 30. Medical evidence continues to suggest that liver processing capacity declines with age, meaning that what your liver could handle easily decades ago may take longer to process today. At the same time, kidney function also tends to slow slightly with age, which can further affect how your body handles excess nutrients. Your metabolism changes too. Your body composition shifts, typically with less lean muscle mass and a slightly higher proportion of body fat relative to your younger years. And since fat-soluble vitamins store in fatty tissue, even modest lifestyle changes over the years can affect how much you accumulate. So when you take a multivitamin every morning that contains 50%, 75%, even 100% or more of the daily value for vitamin A, and you've been doing this for 10, 15, 20 years, the math starts to work against you, even if you've never had a single symptom. Now you might be thinking, but my vitamins say they're safe. The bottle says they meet the recommended daily allowance. If this were a real problem, my doctor would have told me. And that's a completely fair and reasonable thought. Here's the nuance that's important to understand. The recommended daily allowance, the RDA, represents the minimum amount your body needs to avoid deficiency. It's not the same as the optimal amount, and supplement manufacturers are allowed to put multiples of the RDA into their products. Many standard over-the-counter multivitamins contain 100% to 150% of the daily value for vitamin A. Some targeted supplements aimed at eye health or immune support contain even more. Now add up. A multivitamin plus a separate vitamin A supplement, plus maybe a fish oil that has some vitamin A, plus a vitamin D supplement that was formulated alongside vitamin A because they're both fat-soluble and are often paired together in formulas. Suddenly, without realizing it, you're getting 2, 3, or even 4 times what your body actually needs every single day. And your liver is storing what it can't use. Doctors have noticed that many patients with mildly elevated liver enzymes, the kind that shows up on routine blood work and causes concern, are otherwise healthy adults who simply have been over-supplementing for years. This isn't rare. This is increasingly common. What warning signs should you know about? Honestly, that's where it gets tricky, because mild vitamin A accumulation often has no obvious symptoms at first. The liver is a remarkably resilient organ. It can function well even when under stress because it has significant reserve capacity. It's one of the few organs in your body that can lose a substantial portion of its function before you start feeling noticeably unwell. But if excess vitamin A has been building up for a long time, some people do begin to notice things they might chalk up to getting older. Persistent fatigue that doesn't improve with rest. A general feeling of sluggishness or mental fogginess. Mild nausea, particularly in the morning. Headaches that seem to come and go without a clear cause. Dry skin or hair changes. Joint discomfort that seems vague and hard to pin down. None of these symptoms are dramatic. None of them scream liver problem. And that's precisely why it's so easy to miss. But that's only part of the story. Because there's another layer to this that goes beyond vitamin A alone. And this is something very few people talk about. The problem isn't just one vitamin. It's the way many of us approach supplementation in general, and the cumulative load we put on our liver without realizing it. Think about your average morning. You take your multivitamin. You take a separate vitamin D supplement because you read that seniors need more of it. Maybe you take a calcium tablet because you're thinking about bone health. Perhaps you take a fish oil capsule because it's good for the heart. You might add a CoQ10 or a magnesium or an herbal supplement or two, maybe turmeric for inflammation or ashwagandha for energy. Each one of these, individually, may be perfectly fine. Each one may even be beneficial. But your liver doesn't process them in isolation. It processes everything together, in sequence, as a total chemical load. And the more your liver has to process, especially fat-soluble compounds, herbal extracts, and concentrated supplement doses, the harder it has to work. Medical researchers have coined a term for liver stress caused by supplements and herbal products, drug-induced liver injury, or DILI. And large clinical studies have found that this category of liver stress is one of the most underreported and underrecognized causes of liver enzyme elevation in adults. It's not just from medications. Supplements are responsible for a significant and growing portion of these cases. Here's a particularly important point if you're over 55 and managing any kind of chronic condition. Many people in this age group are already taking one or more prescription medications. And some medications, including certain cholesterol-lowering drugs, blood pressure medications, diabetes medications, and others, are also processed through the liver. When you add a stack of supplements on top of prescription medications, your liver may be managing a far heavier load than either your doctor or you realizes, because prescribers don't always know the full list of supplements a patient is taking. This is why, and please hear this part clearly, it is so important to tell your healthcare provider about every supplement you take, every vitamin, every herbal product, every powder, every capsule, every gummy. Write them down before your next appointment and bring that list with you. Your doctor cannot protect your liver if they don't know what you're putting in your body. Now here's where we shift from concern to understanding, because I don't want you leaving this video feeling anxious. I want you to leave feeling equipped. Let's talk about what actually makes sense for most people over 55, based on what the medical community currently understands. First, let's clear up something important about vitamin D, because it often gets grouped with vitamin A, and this causes confusion. Vitamin D is also fat-soluble. It can also accumulate in the body. However, the risk profile for vitamin D toxicity is quite different from vitamin A. True vitamin D toxicity typically requires very high doses taken over time, and many adults, especially those in northern climates or those who spend limited time outdoors, are genuinely deficient in vitamin D. Optimizing vitamin D levels, with guidance from your doctor and regular blood monitoring, is often a reasonable and beneficial step. The key phrase there is, with guidance from your doctor and regular blood monitoring. The goal is to get your vitamin D into an optimal range, not to blindly take the same dose year after year without checking where your levels actually are. A simple blood test tells you exactly what your levels are, and whether you need to supplement at all, or whether your current dose is too much. This is actually the core principle behind smart supplementation. Test, don't guess. For vitamin A specifically, most adults who eat a reasonably balanced diet already get enough from food. Vitamin A is found in dairy products, eggs, liver, and fatty fish. It's also made in your body from beta-carotene, a plant compound found in orange and yellow vegetables like carrots, sweet potatoes, and squash. Beta-carotene is converted to vitamin A in the body as needed, and your body regulates this conversion intelligently. It doesn't overproduce. This is why eating beta-carotene-rich foods is very different from taking preformed vitamin A in a supplement. The food form is self-regulating. The supplement form bypasses that regulation. So if you're eating a reasonably varied diet and you're already taking a multivitamin, there's a strong chance you do not need any additional vitamin A. And if your multivitamin already contains vitamin A, which most do, adding extra from another supplement puts you at unnecessary risk of accumulation over time. Doctors have noticed that simply switching from a standard multivitamin with preformed vitamin A to one that uses beta-carotene instead can reduce that accumulation risk significantly. This is worth discussing with your pharmacist or doctor. The next point is even more important, and it's one that could make a real difference in your long-term health. Periodically reviewing your supplement routine, not just once, but regularly, is one of the most underrated things you can do for your health after 55. Your needs change as you age. What made sense 5 years ago might not make sense today. A supplement you started taking because of a specific concern might no longer be necessary. A dose that was appropriate when you first started might be too much given how your body processes things today. Large clinical studies have found that many older adults are taking supplements they started years ago out of habit, without ever reassessing whether they're still appropriate. Your body at 60 or 65 or 70 is genuinely different from your body at 45. Your metabolism has changed. Your liver's processing capacity has changed. Your dietary patterns may have changed. Your prescription medication list may have changed. Imagine if you wore the same prescription glasses you got 15 years ago. Sure, they were the right prescription then, but your eyes have changed since. What was a perfect fit then might actually be working against you now. Supplements are similar. They need to be updated as your body changes. So what does a smart, liver-friendly supplement approach look like for someone over 55? Start by writing down everything you currently take. Every supplement, every dose, every frequency. Then make an appointment, not a phone call, an actual appointment, to go through that list with your doctor or a pharmacist. Ask specifically whether the fat-soluble vitamins in your regimen are appropriate for your age, your health history, and your diet. Ask about your current liver enzyme levels if they haven't been checked recently. Ask whether any of your supplements might interact with your medications. If you've never had your vitamin A blood levels checked, ask about that too. There is a blood test, serum retinol, that can measure your vitamin A status. It's not part of a routine panel, so you typically need to ask for it specifically. If you're eating a varied diet with plenty of orange and yellow vegetables, dairy, eggs, and some animal protein, there is a reasonable chance your vitamin A levels are already adequate without supplementation. A blood test removes the guessing. For people who genuinely are deficient in a particular nutrient, and yes, real deficiencies do exist in matter, targeted supplementation at the right dose, monitored periodically, makes complete sense. The goal isn't to avoid all supplements. The goal is to supplement intelligently, with purpose, with appropriate doses, and with regular reassessment. Here's something worth knowing about your liver that makes this whole conversation feel even more relevant. Your liver performs over 500 distinct functions. 500. It filters toxins from your blood. It produces bile to digest fats. It stores glycogen for energy. It produces clotting factors that help your blood coagulate properly. It regulates cholesterol. It metabolizes hormones. It converts thyroid hormone into its active form. It processes virtually every substance that enters your body: food, medications, alcohol, supplements, and yes, fat-soluble vitamins. No other organ in your body takes on that breadth of responsibility. And yet the liver operates silently, without complaint, often for years, even when it's under stress. It doesn't hurt the way a pulled muscle does. It doesn't swell visibly the way a sprained ankle does. It just keeps working until the load becomes more than it can quietly handle. Taking care of your liver isn't a dramatic or complicated undertaking. It doesn't require extreme diets or expensive treatments. It mostly requires awareness, knowing what you're asking your liver to process, making thoughtful, informed choices about what goes into your body each morning, and partnering with your healthcare provider to make sure your approach makes sense for where you are right now in life. One more thing worth mentioning, because it comes up a lot. Liver health isn't only about supplements. Hydration matters. Your liver needs water to carry out its filtration functions efficiently. Alcohol matters. Even moderate alcohol consumption adds to the liver's workload, and that's worth factoring in if you're also supplementing regularly. Diet matters. A diet high in processed foods and added sugars puts additional metabolic pressure on the liver. And movement matters, even gentle. Regular walking improves circulation and supports overall metabolic health, which includes liver function. You can support your liver every day with simple, consistent habits that don't require a prescription. Drink enough water. Eat plenty of vegetables, including the colorful ones. Limit processed foods when you can. Be thoughtful about alcohol. Move your body regularly, even if it's just a 20-minute walk around the block. None of this is revolutionary, but combined with a smart, reviewed supplement routine, it adds up to a genuinely meaningful level of protection for one of the most important organs in your body. Here's where I want to check in with you for a moment. Think about your own morning routine. How many supplements are you currently taking? Do you know exactly what vitamins are in your multivitamin and in what amounts? Have you ever had your vitamin A levels checked? Have you reviewed your supplement list with a doctor or pharmacist in the last year? For many people watching this, the honest answer is that it's been a while. And that's not a criticism, it's just reality. Life is busy. Supplement routines often start with the best intentions and then just continue on autopilot for years. But after 55, autopilot isn't enough. Your body deserves intentional care. Very few people realize that a simple supplement review appointment, something that can often be done in 20 to 30 minutes, can give you a much clearer picture of whether your current regimen is truly serving your health or quietly working against it. Make that appointment. Bring your list. Ask the questions. Your liver will thank you for it, even if silently. I'd love to hear from you in the comments below. What surprised you most from today's video? Have you ever had your vitamin levels formally tested? Are you going to take a closer look at your supplement routine after watching this? Your questions and experiences help other viewers too, so please share them. And if you have a family member or a friend who takes vitamins every morning, which is most of us, please consider sharing this video with them. It could make a real difference. Thank you so much for spending this time here today. This is exactly the kind of conversation that matters, and it's a privilege to be part of your health journey. Keep asking good questions, stay curious, and remember, the most powerful health decisions you can make are the informed ones. Take good care of yourself. Medical disclaimer. This video is intended for educational and informational purposes only. It does not constitute medical advice, diagnosis, or treatment. Every individual's health situation is unique, and the information shared here may not apply to your specific circumstances. Always consult your own qualified healthcare provider before making any changes to your supplement routine, medications, or diet. Do not stop taking any prescribed medication or supplement without first speaking with your doctor. The goal of this channel is to help you have more informed conversations with your healthcare team, not to replace that care.